David Cameron says he's not privatizing the NHS. You say he's lying and in no uncertain terms. Talk about it.
Well, my original language was misleading, but he's definitely, lying to the public. The wider government economic policy is to privatise large swathes of our public services. That's the ideology underpinning the economic reforms. Use the private sector to try and grow it out of trouble, and the way to do that is to roll back the state, cut it right back. The NHS is in the line of fire. Before the election and after the election, they've said, we're not privatising the NHS, this isn't happening. Then they bring in a massive piece of new legislation, this massive top-down reorganisation, which they said they wouldn't do prior to the election and post-election in the coalition agreement, and yet that's precisely what they do. And this act basically denationalises the NHS. It removes the Secretary of State's duty to provide a comprehensive, universal healthcare system, and it's going to lead to increasing privatisation, because a third of the act was all about introducing a regulated economic market with lots of external private providers coming in to deliver NHS care. And by the World Health Organization definition of privatisation of healthcare, that's what privatisation is. So the government has lied to the public.
Let's talk about the economics of healthcare for a second. Because it seems to me, and this is a big topic in the United States as well, because they're trying to rein in the cost of the healthcare in the U.S. They're outrageous, and people don't have healthcare. They don't have access to basic healthcare. Here in the U.K., you've got, up until recently, universal healthcare. You have the NHS, which is the jewel of the post-war welfare state, you could say. But isn't it true, if you're just looking at the economics of healthcare for a second, if you're trying to deliver healthcare, which means a lot of pills, a lot of bandages, a lot of scalpels, a lot of stuff, a lot of doctors, isn't it best to have the government go out into the market and buy stuff on a wholesale basis and then deliver the savings to the healthcare user? In other words, by breaking it up and by having all these competing special groups, privatized groups, by definition, they're going to compete with each other and drive costs up. I mean, isn't the point of having a government-backed healthcare? It's cheaper. So, so speak on that a little bit.
No, absolutely, and that was the original vision of a national system. And you touched upon, national procurements, and the NHS needs to do a lot better. But basically, the NHS isn't so much a monopoly; it's what we call a monopsony. It's it controls the buyer's market. We should be able to buy MRI scanners and CT scanners much more, get much better deals on bulk, to re-equip our hospitals around the country. We should do that much cheaper. We haven't done that well. It needs to be really focused on by government to do it properly and do it well.
That word
monopsony.
Yeah. Monopsony is actually, we were involved in something a few years ago, which tried to leverage this monopsony. Why can't I say this word, doctor? I need to see a doctor. But so you're putting the power into the consumer's hands, essentially, to get the best price.
Yeah.
Then people go to Walmart and they want a cheap price, and they love that. So why wouldn't they want a cheap price on healthcare? Why do people? How does the propaganda work? How did the private interests get people to go against their own self-interest by agreeing with the propaganda that they want privatized healthcare?
Well, what they do, they keep bringing up the supermarket argument. Look at Tesco's. They're doing things much more efficiently. But healthcare, is completely different to that type of food market. In general, a loaf of bread, most people can afford a loaf of bread. And there'll be a market price for that. If you fall over and hurt yourself very badly, end up on intensive care for 3 weeks, you could have a £300,000 bill. And no one can afford that. That brings in the whole question. You've got to have an insurance system. And you can't have private insurance, because private insurers will only insure the healthy. They're not going to insure people that are unhealthy, because that will affect their profit. So you've got to have a national insurance system. Therefore, you've got to have a national healthcare system. That was a whole argument. It's quite basic economics. And Kenneth Arrow in 1963 told us that in his famous paper on the healthcare economics. We've known it for years.
Let's talk about this Tesco example, because I brought up Walmart a second. They're essentially the big box, huge discounters. Tesco pass the savings on by being monopolistic in their procurement process. They lean on suppliers, and they're doing so for the benefit of shareholders and the management of Tesco, who get rich by leaning on suppliers. Why not just apply that to your healthcare? In other words, I want the best, cheapest healthcare I can get. Why don't I want the NHS, which is the Tesco of healthcare, essentially, because they're leaning on suppliers to get cheap prices? Why in the average brain, the average nut, to put it in British terms, of the person, why can't they see that?
Well, because the government don't want to spend large amounts on the public service. They want to bring public sector levels of spending right down, and the way to do that is to cut back on our public services like the NHS. This is £20 billion efficiency savings programme at the moment. There's going to be a £50 billion gap up to 2020. The NHS is going to become massively under pressure. It's already under huge pressure. They want to cut it back because it's crowding out the private sector. A well-functioning public sector crowds out the private sector, and their private sector mates who've put them into government and funded their campaigns, they don't want that. They actually want to see public money going straight into private healthcare companies, because then they can, take it for profits, take it to their offshore tax havens, and, it's very damaging to the economy,
okay.
This actually. It's a false economy.
Here we are at number 10 Downing Street, and there's a line outside the door. And in the line are banking lobbyists who want quantitative easing and bailouts and free money to engage in activity that adds no GDP, that adds debt to the country and undermines the economy. There's that group, the HSBC, Lloyds, Barclays, Royal Bank of Scotland. There they are. Now, in the same line are the healthcare industry. They would like their system that's been working fine for years to continue to work fine in the way that it has been worked. They don't want privatization. They don't want profiteers and all kinds of monopolists and oligopolists destroying it and picking apart and taking all the good bits and leaving all the debt. So there's Cameron, and there's Osborne. And so where's the corruption? Is it in their soul? Is it in their, are they outright taking bribes? Is it outright graft? Or are they just stupid? So they're either stupid, they're on the take, or they're just incompetent. So those are the three choices.
Yeah, I mean, it's right at the heart of that is ideology. And their ideology is a free market ideology, this neoliberal ideology.
But the banks are not in a free market.
Okay, absolutely. But it's
so why do they cater to them?
It's all bull, and they're quite happy to have state support, state socialism for the banks, but they're not prepared to have a healthcare system that's actually going to help grow the economy. It has done fantastically for our economy. There's just been some data and a paper that's come out from Oxford University and Stanford University that shows actually healthcare spending has a fiscal multiplier of around 4.3 with good confidence intervals around it. So 4.3 is a fiscal multiplier. I mean, we should be increasing healthcare spending, because what austerity does, it increases demands on the system because of the social determinants of health. Poverty, poor housing make people iller, so you're going to get more people actually coming into to want the healthcare service, and that's what you're seeing with the A&E crisis we've got at the moment. But then you've got the austerity onto the NHS budget, which then we haven't got the supply in terms of the hospitals to deal with it. It's a real perfect storm for the NHS, and they're cutting back. They say they're not cutting. The Treasury has clawed back £5 billion in the last 3 years, and they're saying, oh, it's flatlining spending. But we've got 4% inflation on top of that, so it cuts all the time. And this is what's happening. This government is running down the NHS. They're giving bad headlines, because then the public will say, well, actually, we do need to change it after all. Let these private companies come in. And actually, that is not what the public really want. If they knew the truth of what was going on, there would be huge anger. People would be out on the streets, and that's why we've set up doctors and nurses. We don't want to be bloody politicians, but we feel we've got to tell the public what's going on, and that's why we set up the National Health Action Party to take these guys on and raise public awareness about what's happening to their healthcare system. It's disgraceful what's going on.
Well, I mean, listen to Cameron and Osborne and Boris Johnson, the mayor, who routinely belittles the average British person by saying they're stupid, they can't survive without government handouts. And he just makes a mockery of the whole idea of being a public servant. I mean, the model that Cameron, the ideology that he's pursuing by destroying health care is almost so draconian in its implications that it seems almost like he's more interested in exterminating. I mean, some people are complaining that they feel that the government would rather see them dead than alive with how ridiculously ideologically warped these policies are. But I want to ask you another question here. You are an oncologist, very skilled doctor. If the UK had a US-style healthcare system, you would quadruple your income instantly. So you're arguing to some degree against your own quadrupling of income. Speak on this.
Well, I think, you know, what the NHS has instilled as a national health service is a public service ethos. You know, doctors, for the main, don't go in it for the money. Obviously, there's a few there. You know, we've got 150,000 doctors and there's a few bad apples amongst us. But the vast majority have got this NHS running through their veins, this public service ethos where they want to do what's for the public good. Now, some people do a little bit of private practice on the side. So we've got a separate private healthcare system. I don't personally do that. I'm not ideologically opposed to us having a separate system. But the idea of a competing system is mad because it undermines the doctor-patient relationship. It's really interesting in terms of American medical professionalism that the American medical profession lost public support faster than any other professional group during the rapid commercialization of their healthcare system in the 70s and 80s. Lost huge public support because they're putting money before patients. When the patient comes in, they say, well, you need this procedure. They make money. So if there's a borderline decision whether someone actually needs a procedure or doesn't, all those borderline decisions, they'll give that treatment. Now, prostate cancer, I manage prostate cancer. If you go and see a prostate surgeon in America, you'll get a prostatectomy. If you go and see a radiation oncologist, you'll get radiotherapy. So it depends who you see in terms of what treatment. In the UK, we have careful discussion in our meetings, and we will do what's best for the patient. We give the patient the choice in terms of what treatment they want to have.
So if I go to King's Cross Station and I accidentally get on the wrong train, the conductor doesn't bother whether I'm on the wrong train or not. He's going to stamp my ticket. Similarly, you're saying in the healthcare system, if I happen to wander into the wrong department of the hospital, they'll just give me whatever procedure they're doing over there in the hospital. They don't really care what the situation is at all. They've got money to make. They've got, you know, quotas to meet.
If you've got the money in the United States, you can get very good care. It's a system where you've got islands of excellence in a sea of misery, because for 50 million uninsured people, it's a disaster. But it's that type of system, and the reason why it's a $2.7 trillion failure, basically, is because of supplier-induced demand, and that goes right to the heart of market failure, which is called information asymmetry. Patients don't know enough. It's going up against the supplier of that service, and if they're trying to make money, the patient is a commodity, and they will take advantage and they will make as much profit out of them as possible. That's what the market does. It makes as much profit out of a system as it can do.
Right, so NHS problem is market failure. That's the problem.
It's right at the heart. Markets fail in healthcare. It's an inherent problem in healthcare. And the more we push the markets, the more it's going to fail. We've had 25 years of a failed market. We need to abolish the market in healthcare and run it as a proper public system, publicly funded, publicly provided, but publicly accountable. We need to be much more open and transparent.
All right, Dr. Clive Peedell, thanks so much for being on the Kaiser Report.
Thank you.